Human height is mainly determined by genetics, and it is impossible to radically change it. However, some exercises can improve your posture, align your spine, and visually add several 5 centimeters of height. In adolescence, nutrition. A balanced diet is the basis for normal growth and development. The diet should include foods rich in protein, calcium, vitamins and minerals, squirrels, meat, fish, eggs, dairy products, legumes, nuts, calcium, dairy products, green vegetables for bone strength, vitamins, vitamin A liver, carrots, vitamin D fish, eggs, vitamin E nuts, greens, minerals, zinc beef, peas, copper, phosphorus, manganese. During deep sleep, growth hormone is produced. Teenagers 13-18 years old are recommended to sleep 8-10 hours a day. The peak of somatotropin production occurs in the first 2 hours after falling asleep, so it is important to go to bed before 22 o'clock. Physical activity. Moderate exercise, swimming, cycling, volleyball, basketball. They can stimulate growth by improving blood supply to bones and the production of growth hormone. However, excessive or short-term loads are ineffective, and heavy athletic exercises can accelerate the closure of growth zones. Health. Chronic diseases. Celiac disease, kidney disease, lung disease, stress, and emotional deprivation can slow down growth. What can be done? Get examined by an endocrinologist. The doctor may prescribe tests for hormones, T4, thyroid antibodies, vitamin D, ferritin, as well as X-rays of the hands to assess the condition of the growth zones. If necessary, stimulation tests can be performed to detect growth hormone deficiency. Adjust your sleep schedule. Follow a regular schedule. Create comfortable conditions in the bedroom. Cool, dark, quiet room. Choose suitable physical activities. Sports that include jumping, stretching, and moderate aerobic exercise are suitable. It is important to avoid overloads and injuries. Reduce stress. Emotional well-being affects hormonal balance and overall health. Is it possible to grow a person's height after the age of 18 or not? After 18 to 25 years of age, a person's natural growth usually stops. By this age, the growth zone's epiphyseal cartilaginous plates in the bones are closed, and the bones stop lengthening. However, there are ways to visually increase height or radically change it through surgery. Visual increase in height. Improving your posture can add 2-3 centimeters to your visual height. Stooping and curvature of the spine steal a few centimeters. So working on a straight back and straightened shoulders can make a person visually taller. Useful for this, exercises to strengthen the muscles of the back and core. For example, planks, bridges, stretching, and posture exercises. Massage. Professional massage can help relax your muscles and improve your posture. Body position control during the day. It is important to avoid prolonged sitting in a bent position and to monitor the posture when walking and standing. Surgical growth augmentation. The radical method is surgery to lengthen bones using the Gavril-Ilizarov method. The principle is based on distractive osteogenesis. The bone is artificially broken, fixed with an apparatus, and then gradually, usually 0.7-1 per day, stretched. In between, new bone tissue grows. Operation features. It is performed simultaneously on both legs, more often on the shins, less often on the hips. It lasts for 6-12 months or more, depending on the desired increase in height. Requires the wearing of an external fixation device, for example, an Ilizarov device. It is associated with risks, infections, joint stiffness, bone fusion disorders, neuropathies, and other complications are possible. It is used not only for aesthetics, but also for limb disproportion, the consequences of injuries, and congenital bone abnormalities. Why don't other methods work? Hormone therapy. If the growth zones are closed, injections of growth hormone will not increase the length of the bones. This method can be effective only in childhood and adolescence with somatotropin deficiency. Physical exercises. After closing the growth zones, stretching exercises, Hanging on a horizontal bar, jumping, and other loads will not affect linear growth, but they can improve posture. Nutrition and vitamins. Balanced nutrition is important in childhood and adolescence, but after the closure of growth zones, it will not be able to stimulate further growth. Before deciding on any methods of growth correction, it is necessary to consult with an endocrinologist, orthopedic traumatologist, or other specialist. Self-medication or rash actions can be harmful to health.